Sadly, using the wrong PPE or not using it, period. There's injuries out of that, whether it's inhalation or it's fall from heights or is something, you get all these.
We're still seeing occupational disease claims with workers' compensation boards. So how do you get again, that ties back into the hearing. How do you get ahead of it? How do you ensure that you've caught your workers who need the good hearing protection before they've retired and now they're experiencing the hearing loss? So
Okay.
I'd say it's the full circle of managing all components of your workforce.
The common injuries that we see in our workplace are fairly straightforward. There's nothing really new. It's the classic things around slips, trips, and falls, cuts and lacerations, and then exposures to moving or falling objects, kind of thing. So the challenge is to be sure that we've minimized these potential energy sources, or we've somehow intervened in the energy flow pathway to prevent an adverse outcome for a worker.
Well, in the area like the drug and alcohol, probably the biggest change I've noticed is the steroids. Where, is there a way that you can be doing testing for steroid use that has a different effect on the individual and their way of handling situations? So it's the steroid use, not just marijuana and alcohol.
I hate using the word buy-in, but mostly it's understanding the culture and the reasoning behind the health and safety. Like this morning we talked about the generations. Well, we have a society now where the generations start from 18 years old all the way to 75. But trying to get everybody to understand the same concept is really, really challenging.
Well, investing in a health and safety program in your organization is really just good business sense. And there's many studies and many factors that show companies are profitable because they apply safety programs, no matter what those are, into their organizations because it reduces loss in their organization. Reduction of loss means greater profit. Lots of people don't do it because they never track what their losses are or understand them, so they have no idea of knowing that they actually are losing financially from that process and think it's just a cost of doing business.